Let's speak more on this trend. We're joined by Professor Adrian Puren, Head of Department at the National Institute for Communicable Diseases. Prof, thank you very much for availing yourself on this Freedom Day. So what is the average daily rise in infections week on week since the start of the fifth wave?
So in fact, by comparison to last week, we have about a 200% increase in the number of cases. And we are certainly seeing a marked increase in what we call the proportion testing positive as well. That has also increased very dramatically over the last week, and it's about over 18 to 20% overall. This varies by province, but certainly Gauteng, KwaZulu-Natal, Western Cape have certainly the highest numbers of testing positive. So yes, a very dramatic increase, especially in Gauteng and KwaZulu-Natal. You can certainly now, when you look at the graphs, see a very sharp inflection similar to what we saw with our fourth resurgence at this time. I know it's a bit early, but we are not seeing any marked changes with regard to hospitalizations in terms of ICU capacity and so forth, as well as mortality as well. But as you know, these are lag indicators, so we'll just have to see in the next week or two whether or not there are any dramatic changes in those settings of the hospitals in terms of ICU and bed capacity and oxygen utilization.
Prof, what do you attribute this rise to, right? So we just heard Dr. Nicholas Crisp speak of perhaps a movement of people during the Easter holidays. We have Freedom Day celebrations where a number of people were also gathered for various political parties to hear what those leaders have had to say, or do we put this down to the subvariant?
There could be multiple factors that could play a role. One could be the fact that we have these sublineages of Omicron in circulation, which may have an advantage over the previous Omicron lineage, BA2, in that you have higher transmissibility. But I think also contributing factors may well be the fact that we have certainly uplifted the Disaster Management Act, and that has allowed for greater mobility, the relaxation of particular non-pharmaceutical interventions. And again, we have a very challenging vaccine program as well. So I think there's a combination of factors, I think, that may well have led to this. We're not seeing a new or different variant, so I think it's really, we can certainly ascribe it to probably the sublineages BA4 and 5 specifically that may well be contributing to what we're currently seeing.
What about mortality cases, and could we see a backlog there?
I think that, yes, certainly there are backlogs in terms of reporting, but I don't think that there's a dramatic change at all at this time. And as I said, again, we just need to be cautious because, again, hospitalizations and mortality are lag indicators, so we'll certainly see if there are any changes. But I would have thought that if there's a dramatic effect of this particular sublineage in terms of severe disease leading to hospitalizations and death, we would certainly see some reflection of that already at this particular point. But at this time, we're not seeing that. In fact, we're seeing a decrease in hospitalizations and deaths as well. I mean, again, there's subtleties and variations, but I think the overall picture for South Africa is that there's no dramatic change.
Right. We've been reporting on the channel for a number of days now or weeks about the situation in China, in Shanghai, in Beijing. What does the NICD perceive for South Africa with this dramatic rise in the number of cases? A long way away from there, or we shouldn't be complacent, I guess.
No, we shouldn't be complacent. I know we're focusing again specifically on a resurgence in terms of the numbers. But I would like to think that perhaps if the sublineages are what they are currently, that we will still see maybe a very dramatic change in the numbers of cases, which we're currently seeing. And hopefully, again, we'll have this, if you like, disjunction between what we're seeing in terms of cases versus hospitalization and death. So I think our focus should really be on what's actually happening at our hospitals and seeing what happens there. I think, again, we need to emphasize, I know this is tedious for communities, but really we should really still be encouraging people to get vaccinated, especially in the older age groups. This is really critical, and especially those with comorbidities. I think China's a bit different in the sense that they had a very strict lockdown throughout the last 2 years. And again, their vaccine program is different in the sense that they did not vaccinate specifically older age groups. So I think there are lessons to be learned from that in a way. But also I think we have our own unique scenarios. And so I agree with you, we should not be complacent. We should still be encouraging people to make sure that they adhere to the so-called non-pharmaceutical interventions. I know that there are discussions around the regulations and so forth, but I think those matters such as mask wearing indoors, smaller groups, physical distancing, some level of hygiene, and especially hand hygiene, I think is critical as well. Given that also that, in fact, we're also moving into the winter season, so there's going to be congregation, and there are other viruses as well in circulation. We've seen that there's an increase in the respiratory syncytial virus, RSV. So again, I think our concern is around infants and younger, and in older age groups, and then influenza as well. We're certainly seeing sporadic cases. We don't vaccinate much in South Africa around influenza, yet it is a serious disease. And so again, I think that combination of events, I think, must make us be cautious and take heed of calls for vaccination, calls for implementation of non-pharmaceutical interventions, even in the outdoors. And I know that the risks are thought to be low and are lower, but again, if you're in a setting where there's limited physical distancing, limited mask wearing, there are risks attached to that, even if you're outdoors.
Prof, you speak of a concern around infants. How would you describe it? Mild, moderate, or high?
Yeah, so for RSV can be a very serious. I think there's again like Omicron, like COVID-19, you can have large-scale infections and mild infections. But again, the concern is that in younger infants, especially as we've not had RSV seasons, there's certainly going to be an immunity gap. So again, the projection, at least the model that the NICD has published in collaboration with others, certainly shows that because of this immunity gap, we can certainly see more severe disease in the young age groups, in particular in infants. So I think, again, we need to encourage people to be cautious. And again, our monitoring will be around hospitals, especially ICUs, and oxygen utilization as proxies to really indicate within that particular group whether we're seeing RSV as a major contributor in infant morbidity and mortality.
Thank you very much for availing yourself, Professor Adrian Puren, Head of the Department at the NICD.